Dr. Richard Lavi at Allergy Asthma and Sinus Relief Center offers advanced care for allergy, asthma, and immune deficiency. Our professional staff is dedicated to offering the highest level of care to patients of all ages. We have 3 convenient locations to serve you. Call or visit us online today.
Many people are unaware that the nose, lungs, and sinuses are all connected and talk to each other. If allergy troubles the nose, it may also trigger the lungs, causing wheezing and coughing. That's what we call allergy-induced asthma. Often, pet allergies are the biggest cause of allergy-induced asthma. If you suspect you might be suffering from allergy-induced asthma, see your physician and get some relief. I'm Dr. Richard Lavi, inviting you to breathe better this year.
Welcome to 30 Seconds to Better Breathing with Dr. Richard Lavi.
We all know that exercise is good for us, but for some people, beginning an exercise program can bring on what's called exercise-induced bronchoconstriction. You can avoid these problems by warming up before you exercise, exercising when pollen levels are down, breathing through your nose, and most importantly, see your doctor and come up with a plan that will keep you breathing better while letting you perform every exercise at every level. I'm Dr. Richard Lavi, inviting you to breathe better this year. The most common spring allergy that most people suffer from is tree pollen. That's what causes hay fever, the itchy eyes, runny nose, coughing, and even wheezing for those who suffer from asthma. Some people get instant relief from over-the-counter medications. Others need steroid pills or injections to get relief. And for some folks, allergy injections may prevent or lessen symptoms all year round. Talk with your doctor and get a game plan that will work for you. I'm Dr. Richard Lavi, inviting you to breathe better this year. We've all heard the saying, the best defense is a good offense. It's no different when you're fighting allergies. The best thing you can do to make certain you breathe better this spring is to start planning now. Begin taking medications such as intranasal steroids now to get your nose ready for allergy season. Plus, make certain you're allergy-proofing your home, especially if you have pets. Getting ahead of allergies is the best way to combat them. I'm Dr. Richard Lavi, inviting you to breathe better this year. Have you ever wondered if you're dealing with an allergy or simply have a cold? Usually it's all in the symptoms. A sore throat and fever are the surest signs of a cold or virus. Allergies are more congestion, sneezing, and itching that come on suddenly, especially after you're exposed to something suspicious like a pet or pollen. Once you've seen an allergist and determined that an allergy does exist, treatment can begin immediately, and relief will be on the way. I'm Dr. Richard Lavi, inviting you to breathe better this year. Eczema is an inherited condition that most people outgrow. Moisturization and good skin care with gentle soaps and non-irritating skin products can be very helpful. A child with eczema is more likely to develop hay fever, asthma, and possibly even food allergies. The more extensive and severe the eczema is, the more likely allergies to be part of a person's life. Although there's no proven prevention for eczema, probiotics are now being studied. I'm Dr. Richard Lavi, inviting you to breathe better this year. Food is life, but for some people, food can be life-threatening. After eating, some people may notice itching, swelling, coughing, wheezing, and stomach upset. This is the start of a food allergy reaction. Some of the most common food allergies are milk, eggs, peanuts, wheat, corn, soy, fish, and shellfish. Some we outgrow, but every food allergy is a potential emergency. An injection of epinephrine is the best treatment, and seeking emergency medical care is vital. I'm Dr. Richard Lavi, inviting you to breathe better this year. There are some allergies that only manifest themselves during a particular season. For instance, fall brings weeds in the fields and mold spores in wet grass and leaves. Ragweed is a major fall allergen that's often confused with goldenrod. Keep damp and moist areas of your home dry and bleach any visible signs of mold. Using air conditioning and high-quality HEPA filters in your home and using medications that are safe and effective is the best advice for fall allergy avoidance. I'm Dr. Richard Lavi, inviting you to breathe better this year. Think you may be suffering from allergies? Visit an allergist. An allergist can discuss your symptoms and investigate what has and hasn't worked for you. After examining you, allergy testing may be performed to determine what triggers your symptoms. A plan for avoiding allergens, using safe and effective medications, and discussing non-prescription options such as allergy injections or sinus irrigations will then follow. I'm Dr. Richard Lavi, inviting you to breathe better this year. Pain medications such as ibuprofen, also known as Advil and Motrin, can cause hives and swelling, even life-threatening allergic reactions. Patients with asthma may have worsening of their breathing with medications like ibuprofen or heart medications such as beta blockers. Thankfully, most reactions to drugs are not life-threatening. Drug rashes are easy to treat, but a reaction that involves hives, swelling, or breathing problems needs to be immediately addressed. I'm Dr. Richard Lavi, inviting you to breathe better this year. Most bee stings are painful and cause localized swelling, but the person who is stung and then develops swelling where they were not stung or has rash or trouble breathing has a true allergic reaction. Seeing an allergist for treatment options and prevention of life-threatening sting reactions is very important. If it's determined that you have a life-threatening reaction to stings, carrying injectable epinephrine, also known as adrenaline, is a must. I'm Dr. Richard Lavi, inviting you to breathe better this year.